Hello, and welcome to a Swift View on Health. My name is Scott Schoenvogel, and I wanted to share an interesting update that came out this past week from the Kaiser Family Foundation. So they're really one of the largest organizations studying healthcare in the United States. And they're constantly out there looking at trends and impacts for different healthcare policies and overall organizational industry trends. And they recently released what they thought was going to be renewal increases for small business health premiums in 2027. So super interesting finding. We know that costs and renewal prices were really high last year. And so we were curious to see if that would hold up for this year, and it has. So out of 295 insurers analyzed, the median increase, so just kind of the middle point, the most common one was 14%. So that's well over kind of our historical kind of 10% maximum. So now we're really getting kind of into that mid 14 to 15% range. And 20% of those health plans were over 20%. So closer to that 30% range. So significant increases in the fully insured business, as well as just other small business premiums in the marketplace. Very significant cost increases. I would expect for most small businesses to actually have final numbers, particularly when you factor in utilization in 2026, to have increases over 14%, and in some cases, well over 14%. So, what they're talking about in terms of what's really driving this trend, and we've spoken to a lot of these before, but particularly hospital prices and costs keep rising. Two is that, there's been a significant increase in GLP-1 spending. So just an interesting article also came out this week from Bank of America, where Bank of America says that they spend almost $2 billion a year on healthcare. And within like the last 3 years, GLP-1 spending has gone from zero to $250 million. So over 10% of their total spend is just now associated with GLP-1s. Utilization has been increasing. I think insurers are trying to argue that it's post-pandemic, meaning that utilization during the pandemic was depressed. And so much of that utilization was probably necessary, and thus it picked up post-pandemic when people could get better access to care. But I think we're enough time out from the pandemic at this point where, broader industry trends that we see around increases in utilization related to fee-for-service type behaviors is probably, in our opinion at Swift, driving most of that utilization increase. And then finally, a lot of the premium increase is likely associated with the expiring ACA subsidies. So if you've been paying attention, the subsidies went away. A ton of people have been actually de-enrolling from the ACA exchange health plans. Most of those people are going without insurance. So they're becoming what they call self-pay or private pay in the industry, meaning that just the individual self is going to pay those expenses. Just so you know, providers do not consider private pay accounts or self-pay accounts to be very collectible. In fact, they usually collect less than 10% of those dollars. But the impact that it has on insurers is actually around increasing risk in the kind of the pools that they're insuring for the remaining ACA coverage. So when healthy people leave because they don't think they need insurance and they can't afford to pay it, the people that have to stay insured because they would have no other way to pay otherwise tend to be sicker, which drives up the overall kind of cost of the healthcare risk pools that remain for those insurers. So insurers are expecting, once again, their cost to increase due to adverse selection, riskier populations within kind of their ACA exchange programs and products. So if you're a small business, you need to start budgeting now to be able to afford these increases. If you want to keep your same plans. You're going to probably need to start doing more plan design changes or looking at new health plan models. This is something, once again, that SWFT can help you with. And then finally, you may be faced with some, if you do make changes, just make sure that you evaluate those in the context of workforce retention. Obviously, health benefits are going to be a major focus kind of in the upcoming elections, and I think in business strategy going forward. How that is handled can drive a lot of how you compete for workers out there in the marketplace. So finally, just real quick, I think the key thing is really to start now to get ahead of these increases. Once again, they're very significant. You're going to need to come up with most likely some cost management options, whether that be cost sharing or other approaches, plan design, new solutions, etc., to offset those increases or make it affordable for your company. But once again, you need to begin that work now. And to the extent that you do need to make changes, now's the time to start thinking about how to communicate those proactively. So really appreciate you listening today. And as always, stay SWFT. Thank you.